Welcome everyone. Today we are going to talk about an uncommon but essential topic for those who wish to improve their health in old age. You may be surprised, but what I'm about to share could transform the way you view masturbation and its health benefits. This practice, often surrounded by taboos and judgments, can have profoundly positive effects on your well-being. I want to be clear. This video is informative and based on scientific studies. It has no intention outside the context of health. Please stay to the end and discover how this practice can strengthen your vitality and quality of life. Subscribe to the channel and click on the bell to receive all notifications, even if you have not yet subscribed. Here you will find content based on science, not falsehoods or conjecture. Don't forget to pass this information on to your family and friends so that we can spread this information more widely. Now let's get started. Let's have this important discussion without taboos. We will explore the reasons why masturbation can be beneficial to your health in old age. Health benefits of masturbation in old age. Although masturbation remains taboo, the health benefits for men and women in old age are well known and scientifically supported. These benefits will be discussed in depth, including why they occur and how masturbation contributes to a fuller and healthier life. Improves blood circulation. Blood circulation is the first function to decline with age, especially in those who lead sedentary lives. Both men and women benefit from masturbation, which increases blood flow to the genitals as well as other parts of the human body. This is especially important for men's penile health and helps prevent erection problems. According to a study published in the American Journal of Medicine, regular sexual activity, including masturbation, is associated with a lower risk of erectile dysfunction in older men. According to studies conducted by the North American Menopause Society, women may benefit from increased circulation in the pelvic region to prevent vaginal dryness and improve the elasticity of vaginal tissue. Release of feel-good hormones. During masturbation, the body releases hormones that promote happiness, such as endorphins and dopamine. These hormones provoke feelings of happiness, relaxation, and pleasure. They also help combat stress and anxiety, two common problems in older people. According to a study published in Biological Psychology, masturbation or orgasm is associated with an increase in dopamine levels. This improves mood and relieves symptoms of depression. This natural boost to well-being can be beneficial for both men and women, especially as other physical pleasures, such as more stressful activities, become less frequent. Better sleep. As people age, sleep quality becomes more and more of an issue. This problem can be solved by mutilation. Orgasm releases dopamine, as well as prolactin, which is a hormone that induces sleep. Masturbation is a great way for men and women to improve their sleep. The Mayo Clinic conducted a study that showed that the release of prolactin after orgasm can help induce a deep state of relaxation and facilitate sleep onset. Masturbation is a great alternative to sleeping pills, which can have unpleasant side effects. Men with prostate problems. For men, regular masturbation can help maintain prostate health. According to some studies, frequent ejaculation may reduce the risk of developing prostate cancer. Harvard Medical School conducted a study that followed more than 30,000 men over several decades. They found that men who ejaculated frequently, including masturbation, had a lower incidence of prostate cancer. This is because regular ejaculation helps eliminate toxins and carcinogens that build up in the prostate over time. It also keeps the male reproductive system healthy. It improves women's vaginal health. Masturbation is an excellent way for women to maintain vaginal health, especially after menopause. Women often experience vaginal dryness and loss of tissue elasticity due to declining estrogen levels. This can lead to discomfort or pain during intercourse. Regular masturbation stimulates the production of vaginal discharge and helps maintain healthy tissues. This can prevent these conditions. According to studies by the American Menopause Society, regular vaginal stimulation may help maintain lubrication. Masturbation may also reduce the risk of urinary tract infection and discomfort in the intimate area while boosting the immune system. Masturbation may also help boost the immune system. A study published in the journal Neuroimmunomodulation showed that sexual activity, including masturbation, stimulates the immune system by increasing the number of white blood cells in the body, which are essential for fighting infections. Orgasm also causes a temporary decrease in cortisol, the stress hormone. Masturbation is one way to reduce chronically elevated cortisol levels that can weaken the immune system. Increase libido by maintaining sexual function. Regular masturbation is beneficial for both men and women as it helps maintain sexual function, which can be lost with age. Masturbation stimulates the sexual organs and maintains sexual desire. This prevents the loss of libido associated with the decline of sex hormones. According to a study published in the Journal of Sex Research, regular masturbation helps men maintain their erectile functions and women prevent decreased vaginal sensitivity. It's a great way to ensure that both partners have the same level of sexual responsiveness when having sexual interactions. Relief from chronic pain. The release of endorphins by the body helps relieve pain. These substances are natural painkillers that help reduce chronic pain, such as back pain and joint discomfort, common among the elderly. According to a study in the Journal of Pain, masturbation is able to provide significant pain relief. This is partly because it releases endorphins and other neurotransmitters that help block pain signals. Both men and women can use this natural form of pain relief without resorting to excessive medication. These benefits prove that masturbation is not a taboo or a myth. Both men and women can benefit from this healthy practice. Masturbation is not only good for sexual health, but it can also improve quality of life. It can prevent disease, help you sleep better, and reduce stress. These benefits have been demonstrated in scientific studies, so it is important to consider this practice in the context of self-care and health, and to promote a happier, more active life as we age. Pornography is not for consumption. Masturbation, as we have seen, can be beneficial to health, especially at older ages. The scientific studies we have cited demonstrate the positive health effects of masturbation for both men and women. It is important to note that masturbation and pornography consumption do not have the same meaning. Pornography consumption can be detrimental to your mental, emotional, and physical health. It is best to masturbate without consuming pornography for the benefits. This way, you will protect your body and mind from the harmful effects of this addiction. Pornography is harmful. Over the years, pornography has been linked to a number of emotional and psychological behavioral problems. The severity of these problems may be greater in older people, as the brain's resilience decreases as we age. Pornography use can exacerbate feelings of depression, anxiety, and loneliness in older people. Brain damage, negative effects. Pornography releases large amounts of dopamine in the brain, the neurotransmitter associated with pleasure. The brain gradually becomes less sensitive to dopamine. This leads to the craving for the constant need to seek more pornographic stimuli to achieve the same level of satisfaction. This can lead to a dependence similar to drug addiction. A study published in the Journal of Behavioral Psychiatry found that pornography consumption can alter the structure and functioning of the brain. This results in memory loss, concentration problems, and poor impulse control. These effects are devastating for older people, as pornography can worsen the natural deterioration of the brain that occurs with age. Pornography addiction can also lead to feelings of loneliness and isolation, as well as a lack of interest in meaningful, healthy relationships. Sexual dysfunction problems. Pornography consumption can lead to sexual dysfunctions such as erectile dysfunction in men and decreased libido in women. In a study by the International Society for Sexual Medicine, men who regularly consume pornography are more likely to experience erectile problems and lose interest in sexual relationships with their partners. Pornography can also create unrealistic expectations about sex that lead to disappointment and frustration in real life. This is especially true for older people who already have natural sexual challenges due to their age. Pornography can exacerbate these problems and affect self-esteem. Negative impact on relationships. Pornography can cause emotional damage to relationships even in older people. Pornography addiction can cause emotional and physical separation between partners, even if they are still sexually active. Pornography promotes instant pleasure and the objectification and exploitation of the body, rather than cultivating intimacy and real affection.